Hello everyone, welcome back to the channel. Next Ben here. We are happy to have you back on the channel. Did you know that angina is classified as one of the early signs of a heart attack? Yes, indeed. And angina is one of the most tested items on the NCLEX RN exams. And so today we want to do a quick review on what angina is and what you need to expect as a nurse, as well as what you need to expect whilst preparing for your NCLEX RN exams. To all our returning subscribers, we say thank you for choosing this channel. If you are new here, I want you to subscribe to the channel, like this video as we present more videos on what a nurse needs to know whilst he's preparing for the NCLEX RN exams and the nursing career as a whole. Stick with me as we dive into today's video. So angina is usually described as heart pain from myocardial ischemia. So when the muscles of the heart do not receive enough oxygenated blood, that is referred to as heart ischemia, and usually it is accompanied by pain, and this pain is what we refer to as angina. So usually in angina, we say that the myocardial oxygen demand exceeds myocardial oxygen supply, and this is usually as a result of atherosclerosis or a blockage in some of the coronary arteries. Now, it is important to establish what could possibly bring about angina, which is the chest pain. And there are a few things we can look at. So first is coronary artery occlusion. We also have coronary artery spasm, and we have any other condition that may lead to increased myocardial oxygen consumption. So usually with anything that has to do with a reduced blood supply to the heart muscle itself, it can cause angina. Now, because we are talking about angina and chest pain resulting from myocardial ischemia, we want to also look at coronary circulation, because most often it is the coronary arteries that supply the heart muscle itself. So the blockage or the spasm is likely going to result from one of these arteries. And so we want to quickly review our coronary circulation. So we know that oxygenated blood from the left ventricles is being pumped throughout the body, and the heart also receives its share of this blood. And so down the aorta, we get into the coronary arteries, which branches into the left and right, and the left usually supplies the left side of the heart, and then the right coronary artery supports the right or supplies the right side of the heart. Now, the left coronary artery further divides into some smaller arteries that goes into the base of the heart. So you have the circumflex coronary artery, and you have the left anterior descending coronary artery. So because the left side is thicker than the right side, more of the vessels need to go down to the left side, so it supplies every bit of the myocardium. So that's the coronary circulation in brief. Now let us move on and let's talk about the characteristics of angina pain. It is important to understand that pain accompanied with most of medical diseases or medical conditions have specific characteristics that we need to look out for. So with angina pain, we want to quickly look at its characteristics, and usually it can develop quickly. It can also be slow. It is usually a mild to moderate level of pain. Now, these are the ones I want you to take note of. It is being described as substernal. So just beneath the sternum, it is crushing and squeezing. It may occasionally radiate, so the pain could be felt substernal, but it can radiate to the shoulders, to the arms, to the jaw, to the neck, and to your back. Now, with angina pain, it should usually be up to just 5 minutes, but on some occasions, it can also extend to about 20 minutes, and it's usually relieved by rest or a medication we call nitroglycerin. So, let us move on to types of angina. So, there are three major types of angina, and we'll be looking at them briefly. So, the first one we'll be looking at will be stable angina. Now, stable angina can also be called exertional angina. This means that it is caused as a result of physical or emotional exertion. And usually this type of pain is relieved by rest or nitroglycerin. Now, the second type of angina pain is what we call an unstable angina pain. So this can also be called pre-infarction angina. Now, the name suggests pre-infarction because when there's constant or there's a consistent or a prolonged myocardial ischemia, it can lead to myocardial infarction, which we will talk about in the next couple of videos as we journey through the cardiac conditions that we need to know for the NCLEX RN exams. Unstable angina is also associated with worsening cardiac ischemia. Now, the reason this is because there is prolonged reduction of oxygen-rich blood to the myocardium, and with unstable angina, it is usually unpredictable and occurs more frequently. So when you take stable angina, which is also known as exertional angina, we know that once there is some form of physical or emotional exertion, the pain is going to come. But with unstable angina, it can usually come when you are still resting, unlike the stable one that only comes when you're having some form of physical or emotional exertion. Now, with unstable angina, it usually lasts for more than 50 minutes, and the pain may not be relieved by rest or nitroglycerin. Now, the third type of angina we'll be looking at today is the variant angina. It is also called the Prinzmetal's or the vasospastic angina. This is not as common as your stable and unstable anginas, and this results from coronary artery spasm. Variant angina may also occur at rest and is usually short-lived. Now, with variant angina, you can see changes on an ECG strip when you take one. So when you do a 12-lead ECG, you're likely going to see ST segment elevation, so ST elevations on your ECGs. Now, it is important to know what assessment we need to do to ascertain if someone is actually experiencing angina. The very first one is pain, because we know that angina is chest pain from reduced myocardial oxygen. And so you want to assess your pain and then look at the pain characteristics. Does it fall under what is considered as angina pain? If so, then yes, we can actually say the person is experiencing angina. Now, the other things you want to look out for is dyspnea and pallor. And you also want to look at some palpitations and sometimes tachycardia. Now, what the heart does is that usually when it suffers something, it tries to compensate for it. So the heart may decide, you know what, let me pump a bit more so there's blood going to the myocardium, not knowing that it is because of an occlusion that is probably in the vessels. You also want to look out for dizziness and syncope, as well as hypertension and sometimes digestive disturbances. Let us look at some diagnostic studies. What are some of the things that will indicate or that can help us identify angina? The very first one is an electrocardiography. So that's your ECG. And I mentioned that on some of the angina types, you may see cardiac changes on the ECG. Also, you want to do what we call stress testing. So usually it is just monitoring the heart whilst you are being put under some level of stress. So it could be exercising and you're monitoring your heart whilst you are doing that. You also want to look out for troponin and cardiac enzyme levels. These are very important indicators and they can help us differentiate at what level your angina has progressed. Also, you can go to the cardiac lab where we do cardiac catheterization. Basically, just putting some dye into your vessels and then looking up your vessels to see where the occlusion may be or what the concern may be that is leading to your chest pain. Having understood what angina is, its types and the diagnostic measures, we want to look at what nursing interventions there are that we need to do as nurses. So the very first one is we want to assess for pain and provide pain relief. Now, we know that stable angina can be relieved by rest and or nitroglycerin. So we want to assess the pain, make sure this is on board and see if the pain subsides. Now, we should know that in some cases, the pain may not subside because it is unstable, but you still want to assess the pain and then offer pain relief as needed. Now you want to assess vital signs and provide continuous cardiac monitoring. Now the reason you want to provide continuous cardiac monitoring in this case is because you want to see for any ECG changes. So are there ST elevations, are there ST depressions, and then this can tell you how the chest pain is progressing. We also want to give nitroglycerin. Now this is a medication that helps to dilate your coronary arteries to allow for more blood to get to the myocardium. You want to obviously ensure bed rest, provided it helps relieve the pain. And you want to also do a 12-lead ECG, and you want to establish an IV access so that if you need to give IV medications like morphine, you can actually do that more effectively. Now, it is important that we educate our patients so that they can identify signs of angina and when they need to report to the primary healthcare provider or when they need to get to emergency services. So the very first thing is that you want to assist the patient to identify what precipitates the angina events. So in patients who have a known cause of angina, you want to first educate them so we know the things that can lead to the angina. Also, we want to instruct patients to stop any physical activity and take nitroglycerin when the angina pain sets in, because we know that angina can be sometimes precipitated by emotional or physical stress. The next thing we want to do is we want to teach on how to take nitroglycerin. Now, usually you are allowed to take 3 doses of nitroglycerin to help with the angina pain. If after 3 doses the pain is still there, then that is a sign for you to get help, either from your primary healthcare provider or by going to the emergency room. Now, I mentioned when to go to the emergency room. It is very important that after 3 doses of nitroglycerin and after having some rest, the pain is still there, you want to now go to emergency services. And then sometimes aspirin may be recommended in addition to nitroglycerin, but this needs to be ordered or this needs to be facilitated by your primary healthcare provider. So you don't just start taking aspirin because you know that aspirin may be recommended. It actually needs to be recommended by your primary healthcare provider. So that will be all for today's NCLEX review on angina. In today's video, we explain what angina is. We looked at the characteristics of angina pain. We also looked at the types of angina, and we looked at some diagnostic procedures we can do in order to confirm the diagnosis of angina. Also, we looked at our nursing interventions and the need for us to assess for the pain and to give pain relief. And then finally, we talked about patient education, the things we need to educate our patients on in order for them to be able to properly manage their angina. Thank you for watching this NCLEX review on angina. I hope you had value by watching this video. I want you to like the video, leave a comment for us, telling us what your own experiences are looking after persons with angina, or what people have actually told you that by virtue of this video, you realize that it is not the right thing. And you also want to subscribe to the channel, even as we post further videos weekly on nursing topics that we need to know for the NCLEX review exams. Thank you very much, and we'll see you in the next video.